Hey everybody. New Year's Eve of 2013, I broke my wrist while ice skating. It was the last day that we were going to have health insurance. And I'm going to tie that story in with answering the question so many of you have asked about retiring early and bridging the gap to Medicare. In this video, I'll share 7 healthcare insurance options for you to explore. Before we take this deeper, I want to thank you guys for stopping by our channel. Please take a look around at all of the hundreds of videos that we have on retirement planning. We offer content on Social Security, Medicare, debt freedom, and so much more. We also offer a free just-in-time retirement series. It's a powerful retirement planning strategy based on what you value. And it's going to be helpful to you, especially in this uncertain economy. So please dive into all of that on our channel and visit our website, rebelretirement.com. It was New Year's Eve 2013, and my family and I had taken advantage of a free New Year's Eve ice skating party in our community. We were all skating around and enjoying ourselves when suddenly my feet came out from under me. I hit the floor, I hit the ice. I caught myself with my hands, and all I knew was I had excruciating pain and I was feeling dizzy. I wasn't feeling so well. David skates over and says, "Are you okay?" He asked me, "What happened? Are you okay?" And I said, "I'm not sure. My wrist hurts a lot and I'm not feeling so good. I need to get off the ice. I feel faint." So he helped me up and we got off the ice and we went to sit over in the bleachers and I asked for some ice. And so I was sitting there and I was recovering and David says, "Do you want to go to the emergency room?" And I said, "No, I don't want to go to the emergency room. I think it's just a sprain." I didn't think that my wrist was broken. Now, if you see right here, this little bump on my wrist, maybe you can see it, I don't know. But actually, it turns out that it probably was broken. David continued to ask me, "Hey, do you want to go to the emergency room? Because this is the last day, the last time, almost the last hour that we will be able to go to the emergency room and have you checked out. You can go there, and this is our last opportunity to have it checked out because we won't have insurance after tonight. This is the last opportunity." So I insisted that I did not want to go to the emergency room. I knew that if I went to the emergency room, they would probably want to recommend that I have pins and surgery and all of that. And I just didn't want to go that route. I said, "Well, we can go home. I can elevate it. I can put it on ice and everything's going to be fine." So I didn't take advantage of that last opportunity to go to the emergency room. And starting on January 1st, 2014, we no longer had health insurance. Before I get into my 7 options for healthcare, I want to remind you guys that Medicare is not free. So if you're thinking that you are going to retire and get free healthcare in the United States, think again. Health insurance, healthcare is not free in this country. Medicare comes with fees, it comes with co-pays, and it comes with deductibles. So if you're thinking that you're going to hit 65 and you're going to be free sailing on health insurance, they do not offer free health care for seniors in the United States. That said, let me start with option number 1 for health care if you want to retire early. Option number 1 is to remain on your spouse's medical insurance plan. You can generally remain on your spouse's health insurance plan at work after you retire. Now, that's as long as retired dependents are eligible. So it's best to check with your partner's employer to find out if that's something that you can consider. Option number 2, health savings plans. Health savings plans allow you to save for medical expenses and withdraw that money tax-free when used for qualified medical expenses. What I have found out is that it is best to do your research before you jump into any of these plans. Option number 3, healthcare share plans. Now, healthcare share plans are groups or ministries where members contribute funds and collectively cover healthcare expenses. Typically, a member makes a monthly payment to help pay for the eligible medical cost of fellow members. This is another area where you should do your research, and I will put a link so you can visit Consumer Insight to find out what you need to know there. Number 4, Medicaid. Please don't confuse Medicaid with Medicare. Medicare is a federal program for health coverage for people 65 and over. Medicaid is a federal and state program for individuals with limited income. If you think you may qualify because of limited income, you can visit medicaid.gov for details on how to qualify. Option number 5, state health assistance. Some states offer assistance with medical expenses. You can check your state for options and eligibility. SHIP, State Health Insurance Program, that's the free state health insurance program, can help you answer questions about Medicare and other insurance questions that you might have about state health assistance. Number 6, part-time jobs. Frankly, medical insurance is rarely offered to part-time employees. However, some do. And if you work part-time, it's prudent to ask your employer if you can be on the company's group plan. It can't hurt to ask. And please check out this video on my 9 part-time jobs that offer health insurance. Number 7, health insurance marketplace, also known as Obamacare. Insurers cannot deny you coverage because of pre-existing conditions. They can't charge you more or refuse to cover treatments you had before enrollment in the marketplace. And if you're low income, you may qualify for credits and discounts that will drastically reduce your premium costs. Low income brackets pay very low premiums, and some people don't even pay anything. They pay 0. I also know that the rules for 2026 will be changing, and some of these credits will be removed. Some of these things will be adjusted. So whatever subsidies and tax credits that are available now are going to end. But from what I understand, if you are in the low income bracket, you will still be eligible for those tax credits. So please check into all of that. And I hope this works out for you guys. And I want to thank you so much for stopping by. And I hope this video has been helpful. And if you have any experience with any of these health plans, please leave that in the comments, because this is a topic that I know many of you are interested in. And if you leave your comments, you're helping everybody else in this community. Again, I want to thank you for stopping by. Please give me a like and subscribe to the channel if you haven't done so already. Thanks so much for watching. Take care, everybody, and I'll see you next time.